Hi, Dr. Matti Vazeen. We're going to be talking about diabetic retinopathy and some of the common questions that patients want to know about and want answered about diabetes. The first one is what is diabetic retinopathy? Diabetic retinopathy is in diabetics, the blood vessels in the back of the eye or throughout the body aren't normal after a while, and they have a tendency of leaking fluid and blood after a while. Well, that can then increase in the back of the eye, and eventually, if it hits the center part of the eye, it can cause irreversible damage and decreased vision to the eye. The next question we have is, what are the first signs of diabetic retinopathy? Well, that's a good question, because actually the first signs are no signs. And that's very important to follow up with your primary care, keeping your blood sugars under control, and getting yearly dilated exams by an ophthalmologist. And the reason for that is this. Your first signs in diabetic retinopathy can be decreased vision. Well, at that point, the decreased vision can be already related to a lot of leaking and bleeding of the blood vessels. They don't typically start right in the center. They start out in the periphery of the back of the eye. Once they hit the center and you notice a decrease in vision, we've already are behind the 8 ball and we're trying to play catch up for the rest of the time. The next question is, how is diabetic retinopathy treated? These days we have a lot of treatment for diabetic retinopathy. We can catch it early. We have equipment that is as accurate as 1,000th of a millimeter to see the tiny vessels leaking or bleeding at that time. At this point, then we follow you even closer. Diabetic retinopathy is treated even by a subspecialty of ophthalmology, which is a retina specialist. We have that at Center for Advanced Eye Care, Dr. Wu. And basically we treat it with medication or laser. And we can really effectively shut down the process before it hits the center part of the eye, which would cause decreased vision. Finally, on this part, who should you see for diabetic retinopathy? I think it's a team aspect. I think the first aspect is your primary care or internist, your endocrinologist. These are physicians that are going to manage your blood sugars and your blood pressure and other aspects that are going to prevent the other things that happen in diabetes. As far as in diabetic retinopathy, it's best to see an ophthalmologist once a year, and your primary care, especially Carson, Tahoe, refers it directly to us, and then we take it from there and we see you once a year. I hope this answers some of your questions about diabetes and diabetic retinopathy. The most important take-home message of this is yearly eye exams if you've been diagnosed with diabetes. Thank you very much. I'm Dr. Matti Vazeen.